objective of EP study is to assess the integrity and function of the conduction system of the heart. The next main objective is to identify the mechanism and to locate the exact focus where the arrhythmias is arising from. Risk stratification is the third objective, and the last important objective is to determine the need of treatment, whether treatment is required, and if treatment is required, whether ablation prevents the aberrant circuit, whether your treatment is perfect or not. That itself you can identify in the EP study. What is the anatomical locations which is required for EP study? The first and foremost is superior vena cava and inferior vena cava, through which your guide wire goes into the heart. The four main chambers of the heart: right atrium, left atrium, right ventricle and left ventricle. Now, where is your catheter going to be placed? The first and foremost is the right atrial catheter. The second one is the right ventricular catheter, and this is the coronary sinus catheter, and the final one is the bundle of his catheter. So, you have right atrial catheter, right ventricular catheter, coronary sinus catheter and the bundle of his catheter. So, we have 4 catheters. Coming to the definition of electrophysiological study, it is a test that measures how an electrical signal moves through the conduction system of the heart. For that, you need various catheters, which are flexible tubes which are threaded to the heart through the central vein. These catheters are fitted with tiny sensors that measures the electrical signals in the heart. These are all the various sensors which are located in the catheter. This measures the electrical signal. What is the definition of radiofrequency ablation study? A catheter is placed adjacent to the heart cell that creates the abnormal signal. The EP study will locate the exact location where the abnormal signal comes in, but in RFA, you place a catheter adjacent to the cell that causes the abnormal signal. Then a device which is located on the catheter use radio frequency energy to destroy that abnormal cells. By destroying this abnormal cells, you restore a normal rhythm. This is the principle of radio frequency ablation. This is the sensor and it delivers radio frequency energy. And normally where it is placed, as I said earlier, you have sensor catheter in the right ventricle, sensor catheter in the right atrium and in the bundle of his sensor catheter, and the ablation catheter is placed adjacent to the path where the abnormal rhythm comes. Angiographically, this is the bundle of his catheter, this is the coronary sinus catheter and this one is the right ventricular catheter, and this small catheter with the device is the ablation catheter, which will locate the abnormal cells which generates the rhythm. What are intracardiac electrogram? They record the electrical signal from the heart. This is recorded from high right atrium, which is called HRA, coronary sinus CS, is bundle and right ventricular apex, which is called RVA. The catheter is placed in high right atrium, which is in the sinus node, is bundle which is located around the AV node, here the coronary sinus, along the LA, LV along the mitral valve annulus, and finally right ventricular apex. So, you place the sensor catheter in high right atrium, is bundle, coronary sinus and the right ventricular apex.